Welcome to the Genesis Healthcare Podcast, where we go beyond the traditional office visit to explore what it truly means to live with optimal health. Each episode brings you candid conversations with our Genesis providers and featured guests from across the health and wellness space, covering everything from primary care and prevention to aesthetics and lifestyle optimization. Whether you're ready to take control of your health through a Genesis membership or explore treatment options to look and feel your best, we're here to guide you every step of the way. Ready to begin your journey to better? Visit thegenesisdifference.com to schedule your first appointment or aesthetic consult today.
All right, first of all, Andrew Darlington, we've known each other for 30 years?
We're coming in on 30 years. It was 1997 that we first met.
Okay. In a young couples Sunday school class at church.
Yes.
So AD, as we refer to your acronym of Andrew Darlington, welcome to Genesis Podcast and Genesis Healthcare. You're no stranger around here.
Yeah.
We were just talking about you actually coming by when we were building out the building here.
Yes, my hands are too sensitive to have done any actual work.
Yes, he had his Palmolive hands on, and he did bring food.
That was my contribution to the beginning of Genesis.
Yeah. So it was fantastic. So anyway, can you introduce yourself a little bit and as to what you do?
Yeah. So I would do my first memory of you is after church. One of the elders in the church that Anna, my wife's family, knew from Bolivia, comes up and gives you $100 bill. I think it may have been 50 back then because things were cheaper. But either gave you a 50 or $100 bill and said, "Go take Andrew and Ann out to lunch."
Yep.
And we went to Applebee's on Rome Street, and that was our first time to get to know you and Trish, and that was so much fun.
Yeah.
I mean, and we still stayed at Westminster
even after that
for 30 years. It's been a joy having you. So I do insurance. We do all lines of insurance: personal, home, auto, workers' comp, business bonds, employee benefits, individual health, and group health as well. So we kind of do everything. Started an insurance journey in '97 as soon as I graduated from college. I'd sold books door to door for Southwestern Company, and going to insurance was an easy thing, knocking on doors. In '09, I had Lord basically said, "Hey, you need to go start your own insurance agency. You need to leave your partner, start a new insurance agency." So that's what it is. So in '09, Veritas was born, and we've been blowing and going ever since.
So what does Veritas mean?
Veritas means truth. So I wanted Veritas because it's Latin. It makes me sound smart. And so
we need all the help we can get.
And so that's the reason I picked Veritas. But in the Bible, Jesus says, here it says, "Why are you here?" And Jesus said that you'll know the truth. So when he was asked, "Why are you here?" that was one of the first things he said. And so Veritas means truth. And so that's why we put Veritas in.
Okay. Well, transition.
Yeah.
Tell us the truth about healthcare and what options are out there, true options out there for health coverage, and how we can reach healthcare with that.
Okay. So great question. When people call me, they say, "Hey, I need health insurance." And I'll say, "Okay, so here's what..."
Because it's the law.
Yeah, here's what the landscape looks like right now, okay? You have group plans. Where we are in upper Northeast Tennessee, you only have basically two carriers that dominate the market. That's Blue Cross and United, for the most part. In small groups, larger groups, you get some other carriers, but for the most part, that's what we're looking at there. Then in individual, all you have is the marketplace, okay? Because after when Obamacare came out, you cannot have any other true health insurance. There is an option, and I don't sell it, but I tell people all the time, Farm Bureau has an option. We'll kind of get into the different options out there in a second. But Farm Bureau has an option, but it's not actually health insurance, which is interesting because it acts in every way health insurance, but because they actually medically underwrite, the law doesn't allow that to be health insurance. And so when you look at different things about health insurance, that type of thing, Farm Bureau doesn't apply. Then there's the healthcare ministries, and those are good. You got Christian healthcare ministries, you got Samaritan ministries, some of those that are the health sharing, and those truly aren't not health. They're actually defined as health sharing. So that's kind of the landscape that we have out there.
But it's still legal.
Yeah, it's legal because you're basically saying I'm a conscientious objector, and so you are relieved of not having a penalty should that ever come back for not having actual health insurance. But yes, it is legal and it's growing.
Well, I think that's a lot of what we as employers
Mhm.
are struggling with is what is the legal ramifications of Obamacare and what do I have to do as a business owner? Can you
So,
explain a little
yeah.
bit of that?
So as a business owner, until you hit 50, you really don't have to do anything. But a lot of employers that are under 50 will want to offer health insurance to their clients, to their employees. When we talk to people, we show them the full gamut because not every small business really needs to have a group plan.
Sure.
When you offer a group plan, you might actually kick some of your employees off of Obamacare in the marketplace because if they have a quote affordable plan, then those people aren't eligible for Obamacare credits. And then they have to pay the full price and they won't know it until they file their taxes. And then their CPA or whoever's doing their taxes for them says, hey, you owe us $4,000. And they're like, why? Well, your employer offered a plan. And so that's something that employers really need to keep in mind before you jump in on a group plan, that you need to know about that. But I think one of the things to also mention is what we're seeing a lot of is that people can't afford the old plans. When you and I were growing up, our parents had a plan, $5 office visit copay, $100 deductible, and a $250 max out of pocket. And that's what it was. Those days are obviously long gone, but even the copays are long gone. And what we talk to our clients about is you got to fill in that gap somewhere. Because if you're hiring people and you're offering a plan that's $5,000 deductible, a $7,000 max out of pocket, they're not going to the doctor, okay, at all. They don't.
So you've created health vacuum,
Yeah. So these
healthcare vacuum anyway.
So what we talk about is having a direct primary care provider or some type of membership program because you know your patients, they know their doctor. By having that relationship, they're going to get their annual checkups, those type of things, and it's going to avoid the future.
Right.
The thing that's known but never spoken, insurance companies do not care if you're healthy or not. And you might ask, well, why? Because people say, well, if we do a wellness program, do I get any discount? No. And there's a reason behind that. The reason there's a no is because health insurance companies know they can change from year to year.
Mhm.
So why do they care if your group's healthy? Because they're looking at a 1-year deal.
Right.
So they really don't care. Under marketplace plans, they could care less because they're getting a set amount from the government and they're just going to jack their rates up every year. And so that's why having something like that is so important. And it brings a lot of value. I mean, you think about it, if you're an employer and you're a contractor, how much is your employee staying home one day costing you?
Oh,
A lot of money.
right.
And it's not even them being sick, it's their kids sick.
Yeah.
Because if their kid's sick, they're not going into work.
Right.
But if they have a direct primary care, they pick up the phone, they say, Joe, my kid's sick. I got to get to work. You say, what's wrong? You know what's going on. You can get them health care instantly,
Right.
okay? Or they come in, they're not waiting 3 hours in the doctor's office. They can get it done and know, nope, they need to stay at home, or no, let's get back to work.
Right.
And then you add that wife, the employee
The
themselves.
lost wages is huge.
It's
with what
massive.
we were able to do.
Yeah.
And I noticed a lot of that through COVID and through some of the things that we were able to do there. And even some of my employers, my business owners, would call me 7 o'clock in the morning. Hey, I got somebody just cut their hand. Can you help me out real quick? And I'd say, yeah, meet me at the office at 7:30. I'll be right over. And I sew them up and they're back at work by 8 o'clock.
Yeah.
And that was a workers' comp claim. It was headed to the emergency room. It was however long it takes for you to sit in the emergency room and get that sewn up.
I know.
And then get back to work. So it was a day's work, and I got him taken care of in 30 minutes.
Well, and you look at the price difference too.
Oh,
I mean, there's that price difference. That one emergency room for the sew up, and even, heaven forbid anybody goes to the emergency room for a sew up. But even if they go to a minor med place for a sew up, they paid for direct primary care for at least
4 years.
4 years. Okay, so once every 4 years. As a side note, they still need to report that on their OSHA logs.
Absolutely.
Keep that there, but they do not have to turn.
They don't have to file it.
I would highly recommend they file it. Filing a claim with nothing paid is not going to hurt them at all. Go ahead and file a claim. That way, if something comes back,
Which is a big deal
Yeah.
for a business owner.
file the claim. Say reporting only. It's not going to affect you.
Yeah.
It's taken care of. That way, if something does come in the back end, we've got a guy. Gosh, we've got a guy. He decided he would go to the doctor without telling anybody. Got it fixed, whatever it was. He didn't know what it was at the time. A week later, still wasn't fixed. Now it's a spider bite that's $100,000 claim.
Woo.
And we didn't know about it. And so that's why you always need to make sure,
Yeah.
just a little side note. That's my biggest one so far were that one. I had another one. I was told about a $500,000 amputation on a cut that wasn't taken care of. But anyway, I digress. Those fun stuff. So, but that's why they need that, because you're going to take care of them. They're going to be more profitable than the employer. And then think about the respect that the employee has for the employee at the time, because they're providing something that is helping their family.
Right.
And that's a huge, big deal.
Right. And that's what I've seen a lot of, AD, with some of these employers or employees of the groups who have joined our practice, and people who would never have gone to a provider. They show up and they're like, I get my blood work. I can get that, and I can get a discounted rate for labs, and to where it's not like this exorbitant, and because they can't reach a $5,000 deductible.
No, they're
It's
not going to.
very few people that squirrel away $5,000 toward their deductible and fund an HSA. I mean, you and I walked through Trisha's cancer, and I was $25,000 a year with deductibles and premiums
Yeah.
a year,
Yeah.
and we met it every year.
Yeah.
And so it was one of those things where it was like, wow, I never could get ahead. So you've got these employees who can't reach a $5,000 and $6,000 deductible, and so they're
That's not
just as
legit.
uninsured as if they had no insurance.
Because, I mean, the thing is, well, don't they get a free checkup every year on their plan? Yes, that's required. They might be doing that, but they're still not going to go when they have the sniffles. They're still not going to do those things. They're going to be tired, that type of thing. The other thing that we see a lot right now is we get phone calls, and it's a small business starting up. They're like, hey, we need to offer health insurance. I'm like, I don't think you do. And yes, I know that's odd that they call an insurance person and I say, no, don't. But because it is very expensive. And so we talk about a lot of blue collar workers. Okay, this might sound bad, but it's true, because I meet with them all the time. I'm in front of them on a regular basis. You give them something that's like a $6,000 deductible, it might be as well be $6 million, because it's not going to happen. So you're paying $300 a month for a 25-year-old for health insurance. Why don't you do direct primary care for those guys? Mm-hmm. They're going to have a lot more value out of it. Now, I'm not saying they don't need something catastrophic, but if they have a choice, 98% of them are going to say, I'll take the thing where I can, if I don't feel good, I can go in, I can get a sinus infection check, I can see whatever. It's a lot less money for the employer, okay? The employee sees more value in it, because a lot of the times that you're dealing with this stuff, employers do not get the benefit of offering the health insurance for what it costs. Does that make sense?
Oh, yeah.
And so, but if you can provide something that's less expensive, better, and going to take better care, there's more value in it for the employer to spend money on that rather than the other. And so we're starting to see that more, where they can't afford it. So we're going to offer something that's really nice. And it's a buy-in too. The employer has to be educated, and they have to educate their clients. That's with their employees, because if they're not educated, what's the value? That's not going to work. But I see that trend moving.
Yeah.
As people are starting to grow their businesses, and it makes that employer relationship sticky.
Yeah, and you can even take the injury that was not a workers' comp claim, that the shade tree mechanic that was working at the house, and the wrench slipped and he sliced his hand open, and he makes a phone call. He's going to tape that up, right, and go to work, because it didn't happen at work. So he doesn't have any coverage if he's got a $6,000 deductible.
It didn't happen at work.
Right.
But what's going to happen Monday morning?
Right. It happened at work.
It's going to happen at work.
Right. But but it could also be one of those things that, he could get in really bad trouble.
Yeah.
All right. Because I'm guilty of it. When I was growing up, I couldn't afford health care.
Yeah.
Even when it was affordable,
Yeah.
I still couldn't afford it. So I looked at an injury like that, and I neglected it.
Yeah.
And it cost me range of motion in my shooting hand. Right.
Yeah. Well,
So
that that did
never
not affect,
helped. Really.
that didn't affect your shot.
Yeah, right. It isn't right. But it really it was one of those things where I was like, wow, I had to have surgery because I neglected this when I was
Yeah.
young enough, so young that I didn't have health care or couldn't afford health care. So anyway, it's a lot of those things. Those the as I like to say, the collateral damages that we offer in healthcare. I want to offer a service for businesses that we can actually take care of their employees so that they don't have to worry about that.
Yeah.
And that's why what I do with you as I turn my insurance, my insurance coverage to you, and you give me the best options. And you've told me you need to go to Farm Bureau because this is going to be a better option for you. And I appreciate that. And I appreciate the fact that you're going to give me the truth. And Veritas,
yeah, there you go.
go. Full circle.
And let me mention a couple things, just kind of a bonus for the folks that are fortunate enough to watch this. When you do an individual plan, you cannot deduct that premium for that employee. Okay, it has to be taxed to that employee as income, and they have to report their income, and then you can deduct it as wages. But you can't just pay a premium for them. That's not a qualified group plan. There's companies out there that are saying, hey, why don't you do it this way? You can deduct it. You can't. And especially Farm Bureau. You know why? It's not health insurance. And so there's some things called QSERAs and all these other things. I won't get in alphabet soup names, but you can't do those either with it because it's not qualified health insurance. And so you do need to make sure that you're talking to your CPA. Call me, I'm happy to help, even though I don't make any money off it, still just want to help folks. But to make sure you're doing it right, because you can get into DOL and IRS issues if you're not careful when you are looking at some of these things. And the laws have changed with the DPC, which is with the direct primary care, which is really nice.
Right.
And have you seen, I'm going to ask you a question, have you seen that helping your business with the laws being changed on the tax deductibility and those types of things and the direct primary care stuff?
Early on, there was a lot of questions on could we, and even to you, can I use my health savings account toward a direct primary care premium? And there was, across the country, it was yes. And then here locally, it was like, we still have questions. And now that the law has changed, it totally freed it up. The big beautiful bill basically freed it up. And so the answer is yes. I mean, people now come to us and say, hey, I can use health savings account money. And that's a 30% off the top.
Yeah, just right there.
Right? To as a win. And so it allows us to be a gap for their insurance before they need it. And I like to say, we can be the rotation of the tires and the changing of the oil and the filters and the maintenance of the vehicle. When you turn left in a right-hand turn and you hit the guardrail, that's where the deductible comes in.
Yeah.
You're going to the ambulance, right? So you're going to the hospital and you need some repair.
The important thing is, if you're an employer and you say, oh, great, I can do HSA, so that way we can do an HSA, they can pay for their direct primary care through that. You can only offer an HSA if they have a qualifying high deductible health plan. So you can't just do an HSA as an employer, put money in that, and they pay it. Now, what we are seeing is they have the high deductible plan, they have an HSA, that's perfect. Hey, did you know that you can do this? They can save money and they can pull that out. Or if any of the employees have an existing HSA, they can still pull money out and pay for direct primary care under that. Or if they go and get their own individual plan, again, they can do that. So an employer could pay them the money. They drop that in their HSA, turn back around. The only thing that they lose there is the employer tax deduction and employee tax deduction for their unemployment, Social Security, that type of thing.
Right.
And so we are seeing that a lot, which is helpful to know that there are some options to save that 30%.
Right. Well, I mean, the weeds are out there in insurance.
Yeah.
And it's on purpose.
And there's snakes in those weeds too.
Yes. There are a lot of snakes in the weeds.
I got to tell you, so I had a guy call me. He said, Andrew, I found a much better deal on health insurance than you could get. I said, awesome. What'd you find? He said, there's a self-employed plan I said, okay. It says individual health insurance. I said, okay. Now, going back to the thing, there's only one individual legal health insurance in the United States, and it's through the marketplace. He said, it's United. I said, this was 2 years ago. I said, that's interesting because United doesn't have an individual health insurance plan. And he goes, no, I got one, I promise. I said, great. Let me know when I need to cancel whatever I've got for you. I'll do it. Do me one favor. Just send me what you got. And he sends it to me. You know what it is? A glorified Aflac plan. So these people are trying to sell them health insurance for the self-employed. It's cheap.
Right.
$200 a month. All it is you go to the emergency room, they give you $2,000. That's it. And so these people are moving over those types of things. These people are lying. In an Aflac product like that, they're making between 30 and 60% commission on it. And that's why they're selling it. It's crazy. So you got to be careful, those snakes in the weeds, because it will bite you.
Right. Well, a lot of where I want people, and especially the employers, is to understand, like, what questions should they be asking the insurance agents?
Yeah, good question. So I had one this week, and they've got an employee that lives in Florida, very small company, but one of their employees does live in Florida. We see a lot of that remote work. They're hiring folks all over the country, and they got to go to Mayo. Well, you got to look at those networks because that's very important. What networks are in different things? United has a bunch of different networks available. So you can have one that's kind of a localer, more of a localer. A localer. That's it.
Yeah.
A
It's
local,
like a yodeler.
Yeah, yodeler, but a local network. Or you can have one has a broader network. So they need to be looking at that because that's very important. With individual plans, you're not going out of the state of Tennessee anymore. Pretty much almost exclusively with any of the individual plans. And they need to know that because a lot of companies are saying, we're getting rid of our group plan. We're going to do a marketplace plan. All my employees are going to save money. We can get the direct primary care. We're going to do that. That's a great thing. However, if you're sick and you need to go to Mayo, you're not going to Mayo. If you need to go to Johns Hopkins, you're not going if you have one of those marketplace plans. And it doesn't matter if it's Blue Cross, AMBET, or any of those other ones. You're stuck. And so that's important. Some people, I'll have people in the office, let me ask you a question. If something happens to you, where are you going to go? I'm going to go to JCMC. I said, okay, let me ask you a question. Next question. If something happens to you and JCMC doctor says we have an 85% cure rate, they said, but if you go to Mayo, it's a 98% cure rate. What are you doing? And believe it or not, I have people in my office that say, I'm going to take my chances with JCMC. Because they may not have the means, they might not have the health to be able to do it. There's other things. But a lot of people say, I'm on the first plane to Mayo and I'm there. And they need to know those things because that's a huge, big deal. Mm-hmm. I've had 2 situations where people have actually scheduled surgeries at an out-of-state doctor, an Emory or a Mayo or one of those, or a Cleveland Clinic. And they say, Andrew, it doesn't cover it. I said, I know. They said, why not? I said, don't you remember our conversation? No one remembers their conversation with their insurance agent. I fully get that because
I remember everything you
exactly. And all your patients remember exactly what you told them.
Absolutely.
As well. But that is a big deal. We had to change everything. We actually got him his surgery done at Emory. But that's a huge, big thing to do. And that's why that direct primary care, because a lot of these ins and outs because we've had these conversations.
Sure.
And you can guide them. A doctor doesn't have the time if they're going somewhere else because they got to see the next patient. They're not making any money. Mm-hmm. I talk to these kids, they're like, you're going to be a primary care, that's awesome. But it's not what your dad and your granddad were making. And it's a different beast nowadays.
Right.
And you're the old-timey doctor. And that's what's nice because you have those relationships.
Well, and we were able to sew people up on the back porch of my house, or they meet me at the farm, or it has been nice.
Yeah,
because I don't have to justify a claim to the insurance company.
Yeah,
and that's a term that I use fairly often and fairly loosely, but that's super important for people to understand. Mm-hmm. Like, I don't have to justify my work to somebody who's supposed to pay me for the work I've already done to get reimbursed.
And for what that person has already paid for
Right.
to get done. Yeah.
Yeah, you pay me, I give you a service, and then we have to go beg for an insurance company to pay for that service. Because if they don't pay me, then you have to pay me.
In 90
and then
days.
and then it's like, wow.
Yeah.
Okay, why don't we just cut those guys out and just use them as a major medical?
Mhm.
Which is what I try to harp on with these, especially the small businesses, which we're flooded with in East Tennessee. And you get the major medical plans for your people, and we're the quote unquote gap insurance, assurance of healthcare instead of insurance. And so I just appreciate your honesty, your truth, and what you can bring to the table with Genesis and with a direct primary care model or direct pay model. Are there any other things that you want to talk about from an insurance standpoint?
I want to go back because I think what you said is really important, because people you got to count the cost. The Bible talks a lot about counting cost. When you look at the cost of your care without a direct primary care model, you have the cost of your time, you have the cost of money, but there's frustration too. I had a guy tell me today, before I'm away here, he said, Andrew, I got a question for you. I said, what's that? He said, I had to go, the doctor that I was seeing retired. They got a new doctor. I called, I needed to go see a new specialist. I'm in an HMO, large employer. He said, the provider made me come in to see them before they would give me a referral to a new specialist.
The same specialist they were going to?
No, I hadn't changed, but that guy had never seen me before, so I had to go back in and get a new workup, basically, or he had to come see me again before they would refer me to anybody else. He said the guy was in there for 15 minutes and left, and I got a bill for $140 so that he could send me off to a different specialist. He said, why do they charge me $140 for that? And that's the thing. I mean, those unexpected costs that when you use a direct primary care model, you don't have. You know what your cost is going to be. It's fixed every month. And then that way, when you need something, you get it. I mean, you and I talked during COVID, the number of people you were able to help. You couldn't get into a doctor during those times. You could get Joe. And that's...
Unfortunately.
Joe didn't sleep during those times. But that's the thing is, you never know when it's going to come up. I'm not going to say you're going to see an ROI your first year on a direct primary care. But if you look at every 5 years, between your time, the money you're going to spend, it makes sense. I tell everybody, the future of medicine is direct primary care, but I think it's going to go one step further. I think that there will eventually be, and it's not too far away, direct specialists. And you're going to have
them.
There's going to be a network of folks that you deal with because it's growing. There's the whole direct primary care is growing. I mean, you can go to that direct primary care map and see all the direct primary cares in the United States. It's a thing. And as people become more comfortable with it, you're going to have it. And that's the future of medicine. I mean, we're going to see a two-tier system. We already see it. Remember I said group plans, you can see any doctor in the U.S. The individual plans, you're only seeing Tennessee. Mm-hmm. It's going to continue to shrink because the insurance companies, the doctor, everybody's got to make money. There's a limited amount of money that's being paid out through Obamacare and the subsidies, so they're changing it, and it's crazy.
Well, don't you even foresee? We see this worldwide. Mm-hmm. If you go to Europe, so to speak, and use them as an example, it's a two-tier system there. Mm-hmm. You got your government insurance, and then you got the guy that you pay for. Mm-hmm. So you can wait, 3 months to see him for a sinus infection, or you can call your guy up who you put on retainer, mm-hmm. like you do with Genesis, and then you get to see him, and you get care.
Well, but there's some countries where it's illegal to have that second option.
Right.
And that's the scariest thing.
Right.
Because if there's no second option, what are you going to do? But and the thing that I mean, there's so many nuances to health insurance. And when I get to have these conversations, I enjoy them. I mean, I know this is crazy. I read insurance policies for fun.
That is crazy.
Yeah, because, I mean,
I burn them for fun.
Yeah. So, but you think about, I mean, insurance policies are 300 pages long. It's because attorneys have been involved in them for years and they get it. But I digress.
Well, the
I'll
two-tier
get to
system in Europe, and the reason why we have the two-tier system in Europe, and honestly, it's one of the reasons why I went direct primary care is COVID hit. I started looking at this. I started doing this when we started Genesis 17 and a half years ago, and I just fear came over, and I said, well, I'll accept insurance. I didn't get paid my first claim. I opened on January the 19th. I didn't get paid my first claim until October of 2000.
That is great.
So I worked full-time here and full-time in the emergency rooms in order to eat and keep my kids fed. So we were skinny that year, but anyway, that was thin for a lot of reasons. But I saw the writing on the wall, and I looked at the European model, and I looked at it, and I was like, you know what? They have a two-tier system, and it is the haves and the have-nots, and we're going to have that here in the United States. We tried that with Obamacare. We tried to have, we tried it even back with Hillary care. And TennCare is Hillary Care.
I mean, we did it in Tennessee.
Right.
And it almost bankrupted the state of Tennessee at that time.
Oh, how many? Like it was like 70 or 80% of the budget.
Yeah, I mean
the state's budget the first year.
Well, and the thing that you get is when you lump everybody together, there's no medical underwriting, and that's one of the things. I forgot the other one, but one of the things that we talk about is why is my premium going up every year? It's because what's going to eventually happen, and over time, healthy people, where are they going to go? There's a Farm Bureau option in Tennessee, and now Tennessee's unique in that. There's not other states that have a Farm Bureau. The healthy people are going to go to Farm Bureau. So what does that leave with the marketplace?
Unhealthy. Yep.
So what has to happen? Rates are going to continue to go up. And I tell folks, if you called me and the only thing I could ask you was how old you are, and I had to give you car insurance, and that's the only thing, how old you are, what do you think I'd have to put on your rates? I can't ask you what kind of car you drive. I can't ask you anything about your driving record, the number of kids in your house, nothing. I've got to rate it as high as possible because I got to rate worst case scenario the whole time. It can't get better. I mean, why are the rates bad? Because they have to go worst case scenario. The first year, and this is important, the first year that Blue Cross was in the marketplace, they lost $500 million. Lost $500 million. Yes, you heard that right. Lost $500 million. Okay. Because they didn't know what was going on. They lost some reimbursements, that type of thing. They lost it, gone. That's why year two, the only person in the marketplace was Blue Cross. Okay. And so because of that, they start, and the rates have gone nuts. I mean, the rates are absolutely nuts. The first 2 or 3 years of marketplace, we moved everybody from group plans to individual plans because the networks were the same, everything was the same. And then after a couple of years, the marketplace plans started being more expensive than the group plans. Well, the thing that you have is the stickiness of a group plan. You don't switch jobs just because of a group health plan.
Right.
Okay. So people are stuck in their employer. So that's why it's not as sticky. So there's different underwriting that can be involved there. Individual is not sticky. Every year you can move, you can do whatever you want to. And so that's why those rates have gone berserk,
right,
where before they were there. And it's just interesting seeing how that's happened with the health insurance marketplace. And it's not going to get any better, period. It's going to get worse. As the rates go up and the subsidies come away based on different things, people are going to go to the Farm Bureau. They're going to go to those health sharing organizations, because those are really neat as well.
Mm-hmm.
You and I have talked about those a little bit, but you dump the money in, they pay you back based on what is, and it's the old model. All the money goes in, we divvy up the claims, and hopefully we have some money left over at the end of the year. They're a lot smaller than I'm currently really comfortable with. I like them. I have friends that we actually do some of those. But one of them said, we paid claims of like 700 million last year or something like that. I'm like, Okay, you look at what just Blue Cross Blue Shield of Tennessee paid in claims, and it's dwarfs it. I mean, it's not even it's not even a blip on the radar compared. And so those things are very small. Should something bad happen, who knows what's going to happen? You also have to, and here's another plug why you really have to have direct primary care if you have one of those accounts, because they pre-X a lot of stuff. They'll cover it, but once you're done with it, they're going to put pre-existing conditions afterwards. And so you have to have someone like you that's going to be able to help with drug costs and some of those other things, because they're not going to cover that at a future point in time.
Sure.
And you need to know that if you're moving to one of those plans.
Well, and I'll tell you, when you're talking about like helping with that, because I've uncovered a little bit of the cost of healthcare, and I get to look at. I like to use the analogy of the complete blood count, or the CBC. A CBC. If I charge your insurance, or if the lab charges your insurance a CBC price, they're going to bill about $150. If you have not met your deductible, you are going to pay $150. Do you know how much I charge for a CBC?
Under 20, $4.
$4. And I'm making money. The lab's making money, right?
At $4.
Not a lot, but it's $4, right? Or roughly, give or take. So you do that and take that across a full blood panel, which would be sometimes thousands of dollars that you haven't met your deductible, and I can get it for teens and 20s and 30s of dollars. That's reachable. I can get it cheaper than I went out to dinner last night for Cinco de Mayo, right? So I can get it for cheaper than that, and then I can offer the service of my interpretation, and then I can give you the plan, and I can give you all that for what it would cost one lab bill, and I can do that for the year.
Yeah. People don't know those things.
I know.
mean, unless they have talked to me, because I'll tell folks, the folks I talk to that are diabetic, they're like, well, I can't afford a high deductible plan because I'm diabetic. I'm like, yes, you can. They say, well, why? I say, if you get one that has copays, you're going to pay about 30% more. Why don't you take this one, go find direct primary care. They're going to take care of your meds. They're going to take care of all your labs, that type of thing. And you're going to save money, and you're going to have better care. How long does it take for you when you go to the doctor each time to get your checkups and your A1C and that type of thing? Well, I'm going about an hour and a half, 2 hours, if I'm lucky. You could do that. Just the savings alone is nuts. And then the lab work, none of that's going towards it. It's unbelievable.
Yeah.
And people, that's out there.
And guess what? We give you the opportunity to become non-diabetic.
Yeah.
We can give you a plan to teach you how to not be diabetic again.
And you can spend the time with them.
Absolutely.
And and you and I have a lot of friends that are doctors, and it's no knock on them, but it's just the model that they're in, that they've been forced to be in. They don't have an option. It's not that these doctors don't want to help you. They do. That's why they got into medicine to begin with. But they don't have the time, because I was going to say, if they were in a private practice, there's none around here anymore.
Right.
It's all big business. They have to do certain things.
Sure.
And most of these doctors, they're working 4 days a week before they get a paycheck. It's taxes, their overhead and everything. Their last day is where they're actually making money to put on the table. I was talking to a doctor the other day. I was like, did you not go to part-time? He said, no, I didn't go part-time. I was like, why? He said, because 3 days I'm paying on my overhead. I made no money going 3 days a week. He said, that's why you don't see any of these physicians that are older staying on board for a couple of days, because the way the model is, they have to work 3 days just to pay overhead. And it's not till day 4 and 5 where they're not making any money. So they're just quitting immediately.
Yeah. And it's sad, because that's also some of the collateral damage that we really don't realize, because I relied on my older peers in medicine to instruct me on the day-to-days and patient care. Like, it's so important as a model for a young man to grow up with older older peers in medicine to emulate them and watch what they did and how they did certain things. And I like to tell people, I was like, learn from my mistakes, not yours.
Yeah.
Right.
Well, and I think what's going to happen, Joe, and we've talked about this too, you're going to have some of those old wise physicians that are picking up the phone saying, Joe, I'd like to work a couple days a week. I can't do it where I am,
But I could do a DPC.
but I can join you. So, and then, and you're going to have a transition there. And so you're actually going to have the direct primary care folks having a lot broader knowledge base
Right.
than the other ones, because you have those years of service that those people, they've seen so many different
Yeah.
things. I mean, you think of the things you've seen now than even the last 10 years. And I think it's wild how that movement's going to take place over time. And this is not an anomaly. This is going to grow. I mean, I told you this is going to be huge, because as the prices of the health insurance go up, this model is going to expand and expand and expand. It's just
Insurance is pricing themselves out of the market,
Mhm.
and they're pricing themselves into socialized medicine.
Well, and I tell you this. So I get people, hey, and you send me stuff. I got Joe, and I love them. I just need a high deductible plan. Can you give me? I've done well for myself. Can you give me a $10,000 or $15,000 deductible? I just want it. I'm healthy in case something happens. You know what I have to tell them? I can't. The federal government does not offer a plan with that deductible. You can't do it. It's illegal.
Really?
There's a cap on what you can offer. And so even if someone says, I just want to give me a $25,000 deductible, it doesn't exist. It can't legally exist. Not there. Is that not crazy?
It is crazy, because I mean, like you said, I mean, almost say, I'd love to be self-insured.
Mhm.
Right? I mean, there's some real data on being self-insured
Mhm.
to a certain degree, and having a cap, like you said, like a $25,000 or $30,000 deductible for some of the people that can afford things like
Yeah.
that. Hopefully, we get there one day. But you get there and you go, why can't you do that?
Mhm.
Why can't why couldn't an insurance company offer something like that?
And the other thing is too, is I have companies say, hey, we just want to offer the highest deductible you got and do an HSA. We're going to dump money in their employees' HSA because we want them, that way they can get direct primary care and do that. And I'm like, well, here's the plan. And they said, well, there's a plan with a $9,200 deductible and $9,200 out of pocket. Let's do that when it's cheaper. I can't. Why not? The deductible's too high to offer an HSA. You want to know something else that's nuts? So the federal government has restrictions on that. So on a group plan, again, whenever the federal government gets involved in anything, it's a mess.
Sure.
There's not anybody that's going to disagree with that. I think that's a very easy statement. Everybody says, you're right. With the big beautiful bill, the same plan that Blue Cross offers individual or is offered in the individual marketplace is HSA eligible, but a group plan with the exact same thing is not HSA eligible.
Do you see
makes no
anything,
sense.
any reprieve coming from
None.
the administration at all?
Administration, but I mean, it will never get better. I know what I was going to talk about. I remembered, and this is important.
Talk to me.
The thing that people don't realize is that there's no tiering of health insurance. Okay. And I'm stepping on toes right now. And I'm probably going to people are going to start getting mad at me because I know you tiptoe the line, Joe. You never ruffle fellows.
I don't step on anybody's toes.
But here's what I want you to think about. Okay. You've heard of a guy named Elon Musk.
Yeah.
Okay. Bill Gates. Okay. They have a couple of bucks in their bank account.
Sure.
Okay. You probably don't have one, and I know your house does not quite look like Bill Gates' house is, okay? Nor does your house look like Elon Musk's. You don't have as many vehicles as they have. You don't have the artwork, that type of thing. You know what you do have? The exact same providers if you get sick, because you've got that little card that has Blue Cross or United or whoever on it. So if you have cancer, you will have access to the exact same that Bill Gates has. Because where are they going to go? They're going to go to a Mayo. They're going to go to Johns Hopkins. They're going to go see that premier doctor there. That's where they're going. They take health insurance. So you have nothing else in this world identical to Bill Gates or Elon Musk. Yet your health care is the exact same thing. Think about that. The exact same thing. You have the exact same, to the richest person, one of the richest people in the world, Joe Reed is going to get the exact same care because you have that card.
Wow.
How is that possible that in your life, the only thing that resembles them is that one thing? Because they'd be able to afford anything, but through that card you can. The reason why that's important is, where is the end? Because it doesn't matter your station in life. We expect it and you get it. So with economic forces, that type of thing, it has to go up. It can't come back down. It's never going to end. Because of that, it won't end. So when will health insurance prices level out? Never. It can't go, because there's no one's going to say to Pfizer or to any of these companies, that, whether it's the drug companies, your companies that are making the scanning machines, stop R&D. We're done. We need to get prices back in line.
Right.
And no one wants that. I'm not
Right.
advocating for
Well,
that.
the ethics won't allow it.
Won't allow it. And so there's always going to be medicine that's advancement. I'm grateful for advancements. We all are. We're glad.
I like that the air conditioning just came on.
Yeah.
That was nice.
Well, and the things that have happened 20 years ago that were non-curable, they're gone now. So that's great. But that comes at a mighty cost.
Sure.
That mighty cost is the cost of healthcare going up. So it will never end. It's always going to go up, period. We have to realize that and understand, okay.
As employees, as employers,
Yes.
as human beings in
Right.
the United States, we all have to realize
Exactly.
that healthcare costs are going to go up.
And how do you fix that? You have direct primary care.
Yay.
Because by doing that, you're able to keep that high deductible as much as you can, but you still have the care you need on a regular basis. And you have someone that can say, Andrew, you need the surgery. Don't go here.
Right.
You need to go here. And then you send them to where they need to go, because you know who the best physicians are, usually even not just around here or outside of it.
Right.
The crazy thing is, if you look at the price of a surgery here versus a price of a surgery at a premier clinic, we'll say, it's actually less at those other premier clinics, and people don't realize it.
Mm-hmm.
But you know what else? If the surgery is going to cost $20,000, it doesn't matter the price, because the insurance company paying anyway. So that's the other thing. People aren't looking at the price, so they go ahead and, hey, I don't care what it costs, and they're not looking at that money from the insurance company to kind of offset it. You can get a heart surgery here, or you can go to Cleveland Clinic. Where are you going to go? It's probably basically the same price, maybe even less, but at the end of the day, do they care? And so people need to take control of their health, not their health care. They need to take control of their health, have someone they like, know, and trust, that knows them, that can see them, understand what's going on in their lives, because knowing what's going on with their family, their work, influences health. And you can help with that when you know the things that are going on and you have the bandwidth to be able to take care of them. Then they need to look at their health care and see what's going to be best for them. And having someone that knows, likes, and trusts them can guide them just like you will.
Well, we do our best to try to do that. And I love the fact that we have the time, we have the bandwidth, we have the opportunity to know their family. It's kind of funny that you say that, because I have a lot of students that come in, and they're usually over there typing things that I'm talking about, and I'll walk in and start talking with a patient, and I just see their name, and I just go, oh, let's run in there real quick. And so I run in and I start talking about their care, and then the students will come out and be like, well, how did you remember all of that stuff about them? I was like, I didn't have 30 patients yesterday. that I had to remember, so I can actually dive in. I know their labs. I read their labs yesterday when they came back, and then I knew they were going to come in today, so I was already prepared for the visit. Um, so I already put some things in my brain, and then when I walk in, like all of that data comes right back to me, just like our talking at Applebee's,
Yeah.
30 years ago. It is kind of nice to be able to go, well, I remember, Don Essick coming up and
Yeah.
and doing that.
Yeah.
Yeah. So but those are things that we look at and we go, oh, well, it is the old way of doing things,
Mhm.
and it's not that we want to go back to the old way of doing things. I like modern medicine. I like the ability to do things and get it to see your labs on my iPhone. Right, that's incredible. I was taking care of patients when I was over there with Larry in Europe, and we're sitting there, and I'm getting a text at 3 o'clock in the morning. I'm like, you know, so, but it's nice for me to be able to go, okay, well, let me answer this real quickly and take care of this
And
person.
that's the thing. I mean, you're on vacation.
Hmm.
You can do that.
Hmm.
If you have if you're in the traditional medical, you can't.
No,
You wouldn't have time to do it. You're like, I've got to get away from this. I saw 30 people yesterday. My head's about to blow off.
right,
Okay. But because of, and it's not like you got to go again, look at their charts again. You know them.
exactly.
I mean, it's, and the thing that's unique is that because you have a good team of providers here, you have people to bounce off of, which is great.
Mhm.
But if someone chooses that they don't want necessarily Joe, and why I don't know,
Ah,
but there's a team there, which is so cool because it's y'all have the relationships. You can bounce things off of each other because you all learn stuff every day, and so that's why having a team of people around you and with you is so important with your providers. And as a provider, to be able to help your patients the best, it's just like I said, it's such a unique model. And I don't know if we talked about off camera or not, but a lot of agents just don't talk about it because what's in it for me? I'm not going to make anything, so why am I doing it?
right.
And
And I would say that
it's
that would be
nuts.
something that the employer should ask their agent,
Yeah,
what's in it for him
yeah, not a,
or her? And so if they're not offering something like this, I'd find another agent.
well,
I mean, that's a
yeah.
plug for you and for other agents who are actually offering what's best for their clients.
Well, and you think about it. I mean, if you've got a client, a small business that gets 20 employees, okay, and those 20 employees are at that one location, okay, could be manufacturing, could be office, it could be a bunch of different things, but they're there. It's an opportunity for you to say, hey, let's save you guys some time. Let's knock out everybody's annual visits real quick. And you can go there real quick. Everybody gets to keep on working. They're not missing anything. They're still getting taken care of. What does that mean for the client, for that employer? I mean, it's like, we're not Eastman. How come we're getting this? I mean, it's huge. I mean, there's a lot of things like that. I mean, we have marketplace chaplains in our office. And so we have a chaplain, Larry Stan, love Larry, comes around about once a week, once every 2 weeks, and just checks in with everybody. And how are you doing? And so it's that type of care that an employer does that really shows how much the employer cares about and for his team members.
It values them.
It values them. And it's, I mean, Larry goes around, it's not every day, but when someone is in a crisis situation, they're there, they have the relationship, and they can take care of them. And I mean, the thing that every employer, I mean, when you look at the blogs and all those types of things, what are people needing? How do I attract and retain top talent? Okay. And it's not about the healthcare or health insurance. It is about the healthcare. It's about those relationships. It's about he cares enough for me, she cares enough for me that they want to make sure that I'm doing well and my family's doing well. Because all the stress and those types of things, they come on us. You're taking your stress from home to work, and you take your stress from work to home, and it's there. And when you have a direct primary care, you have a membership with you, you're able to help the employer and take care. Now, you can't divulge anything, but you can take care of those employees so they can have a better work-life balance. They can They can do a better job at work. They can do a better job at home. And they're not worried about all those things that are coming up. And some of those unexpected costs. I mean, what we talked about earlier, you need blood work. It's going to cost me how much? I'm not getting blood work.
Right.
And that can be life or death if you don't get it soon.
Sure.
And with you, it's $25.
It's just like,
Yeah.
yeah.
And that, I mean, I mentioned earlier, it's counting the cost. You got to count those costs. What is the cost of having your employees mentally have to go to the doctor and sit there in the emergency in the waiting room for 2 hours to be seen?
Mhm.
That's another cost. And it's, what do your employees see? How are you loving your employees? We talk about that a lot. How are you loving your employees? How are you really serving them? Because you've been put as their boss. Okay. God ordained it. Now, how are you serving them? What are you doing to love those people, to love their families, and serve them well the way you're supposed to, and take care of them? And that's one of the neat things that a direct primary care relationship can do for the employer and the employee. So another thing that's kind of interesting, people don't realize. Did you know that Blue Cross will offer up to 3 plans for a business for health insurance? Okay. The reason that's important is if you're a small business and you have 6 employees, you can offer 3 plans. So not everybody has to take the same plan. Okay. And so I was actually talking to a company in Bristol. Okay. 2 weeks ago, I emailed them before I came, and I'm like, you've got 3 people that are on the plan. That's it. It's a very small business. Did you know that you can offer 3 plans, 1 for each of them? I said, you've got a family, 1, they got to go to Mayo, and they live out of state. They got to go to Mayo. Okay. We know what their costs are going to be. Whatever their max out of pocket is going to be, it's going to be there. Okay. Then you get 2 people that live locally. One's in his 20s, one's in his 30s. Neither one of them ever go to the doctor. I said, why don't we do 3 plans? And I'll sit down and I say, I'll talk to them about their health care. You don't have their health issues. You don't have to, so you don't know anything. I'll know it. And I can say, listen, Bob, whatever his name is, I don't know his name. You take this plan. Instead of getting a plan, because right now the plan they have, it's a very nice plan, $1,500 deductible, $3,500 max out of pocket, okay, with copays. It's stupid expensive, but they're doing it because they care about their team. They want to help. They love them. I'm like, you are loving them way too much, way too much. I said, let's do this. Let's change the plan. Let's talk to the guy in Florida. Let's make sure that he has the plan he needs for their issues with Mayo. Okay. We know what costs are going to, so we look at the premium. We look at our out of pocket. We calculate their total annual cost. Okay. Then let's look at your people here. They're not using it. They're young. Let's get them a high deductible plan. Okay. They're going to save about $100-ish a month on just an individual. If they do the high deductible plan, put in an HSA, do direct primary care. There's enough wiggle room there that between the HSA that we're putting in place, the direct primary care, and the savings on their deductible, that they're fine. That way, you get young kids, blue collar. That way, when they cut their arm while they're doing something in the afternoon or evening, they're out hunting or whatever, shoot themselves in the foot. No, they're not. But cut themselves. That's going to be bad. But they can say that now they have access to better health care, okay, because they have the direct primary care. The employer's saving money because they're paying part of that premium, okay, so they're saving money. It's HSA. So the money for the direct primary care is tax deductible for the employer and the employee. And everybody has their own customized health plan because they got to pick it. And people don't realize that you can do that on a group plan. And that's really important because you know as well as I do, every one of your team members is unique. Mm-hmm. We're all unique, okay? Not everybody has the same plan. So if you're an employer, you're only offering one plan, that's nuts. Don't do it.
Right. Well, let me ask you this. What about the person who goes to work and there's no they don't get any plan? Mm-hmm. So what would be like a family of 4
okay.
That doesn't have any opportunity at their work to get any health care? Mm-hmm. How do they get health care?
So they have to go to the marketplace or Farm Bureau or a health sharing organization. Those are the 3 options, okay? With Farm Bureau, if you do the HSA, you can do an HSA. With the Marketplace, if you have a bronze plan, you can do an HSA. You can't do an HSA through a health sharing organization unless you have an HSA option on it. I'm still curious about that, if that's actually legal or not, but you can't do that. So what they would do is go to one of those. You can't sign up for Obamacare mid-year unless you're losing coverage. You can't do it. So if you call me, I need health insurance. When was the last time you had health insurance? I had it January. You got to wait till January. You can't get it, which is an issue there. So, but we say, get a health sharing, get a direct primary care, high deductible on the health sharing, direct primary care, and you're all set. Because, I mean, the example is this. If I'm a family of 3 and I'm making over $102,000 a year, I'm not going to get any tax credits to the Marketplace. I'm paying full price, okay? So I'm looking at probably, say, a 30-year-old over there, I'm looking at $1,200 a month to $1,700 a month. Get that highest deductible plan that you can get. All the bronze plans in the Marketplace are HSA eligible, okay? I'm going to save probably $250 a month by doing that. Now I have an HSA. I can dump money into it. I can turn around and pay my direct primary care subscription into that. I'm saving money. And now when my kid has a sinus infection, I don't have the out of pocket I would have if they go to the doctor. If you go to the doctor and your kid has a sinus infection, you're going to spend about $180 to $240 for that sinus infection. I have a subscription with you, and I bring my kid in, and if you find out they got a sinus infection, how much is that going to cost?
Nothing.
So I've saved.
You paid it forward.
Yeah, I've paid my membership, and it's HSA eligible, and I'm good. And you know what's going on with my family, and I can do it quickly. I'm not waiting in the emergency room. I'm not waiting in line to see you. I'm calling you up. Say, hey, Joe, when can I come? Hey, come at 3. We're good to go. Or come at 2. Or hey, come now. I'm open. I'm just fixing cows, so you have to deal with that.
I'll have to wash my hands.
But what you got to understand is people need to shift what they think about health care to actual health care, not health insurance. And if people will structure it right, there is room now to structure their plans, be able to have have direct primary care, and save money and have better care at the same time. It's not, oh, do I want to save money or have better care? That is here because the prices have gone so far high. Gosh, that was horrible grammar. Because the prices have gone up so much, there is room there if you'll adjust plans. And that's what people need to do. You can't just take, I mean, most agencies mail out the renewal with Blue Cross and say, here, we don't make that much money with Blue Cross. We don't make that much money with health insurance anyway. And it's going even less. We try to give options. We spend a lot of money on programs where we can say, I tell folks, I'm going to give you the option for every plan available in the state of Tennessee for your zip code. And you'll be able to look at all of them, okay? And we pay a lot of money for that. And so I give it to them so they can see everything. Because I say, this is the best option, but you probably don't believe me, so I'm going to give you all of them. And so that way they can make an educated decision based on it. But they need to make those educated decisions because, I'll give you another example. I've got a guy, and he wanted to have a drug card where they only paid a certain number of 10, 35, 50 on their drug card, or 10, one of those, because they had high drugs. I said, have you looked at the savings plan available through the drug company? He goes, what are you talking about? I said, you need to go to the drug company, and they have, I can't afford my medicine button. Click the stupid thing. When you do it, it said it'll do $8,000 towards your deductible. So guess what we did?
Got a high deductible plan.
We did a high deductible plan. That saved him like $300 a month because he didn't need it. He hits that in 3 months. So in 3 months, all that $8,000 is his deductible's gone, his out-of-pocket's gone, and he got a lower plan. And he was going to buy the one with the $1035 copay, which was going to cost him out the yin, and he never would have used it.
Right.
And so people need to understand those things because there's ways to save money.
Okay. I agree with that. I agree with all the things that you said. So I want you to explain what's in it for you the agent who, because I know the answer, but I want you to explain this. What's in it for you, the agent, who offers somebody else's plan?
We get nothing. But what we do get, Joe, is right now, I'll brag on myself, our team, we have over 560 5-star Google reviews right now. That's just Google. We got another 4,000 that never hit Google of 5-star reviews. We're double everybody else, almost triple everybody else in the Tri-Cities. So I do say, they say, what owe you for this? I'm like, well, nothing. I just want to help you out. And that's the other thing. When we started Veritas, we do understand that our job here on earth is not to sell insurance, though it's fun. Reading policies, I mean, it's fun. Our job is to serve people. Our job is to serve people. Okay. Jesus said, serve people. I'm going to take care of you. He said, I feed the birds. I know the hairs on your heads. You help people. That's what you're here to serve, help people, tell people about me.
Right.
And so that's what we try to do. I do ask one favor though. Hey, listen, if I helped you, will you just give me a 5-star review? And I love it when they say, what are you getting out of this? Nothing. I said, but give me a 5-star review that says, I called Andrew. I was going to buy insurance from him. He told me not to. He told me to do something else, and it's working out great. And if you go to Google, you will see a boatload of those. Right. That I called Andrew. He said, I was going to buy something. He said, don't do this instead. Right. And it's kind of like the Miracle on 34th Street. Mm-hmm. That's what we do because Lord has blessed us. Okay. I'm in air conditioning. It's nice. Lord has blessed. So, I mean, we don't have to make money. We want to make sure that our reputation is solid. Right. We don't ever want, hey, he sold me. No, we don't do that. Right. We're going to make sure that if we can't help you, we're going to tell you where to go. And especially this crazy health insurance space, it's nuts. And I mean, so I got a good friend of mine and I told him, I said, you're healthy. Get off your stinking group plan and go get a Farm Bureau plan. He's like, oh, I can't. I'm like, why? It was because I have group health for my team. I said, you can do that. You don't have to be on it. As an employer, he can still write it off on an individual plan. I told him he was paying $1,700 a month for his family. Had he gone to Farm Bureau, he would pay $900. $9,000 a year. His max out of pocket for the family with Farm Bureau was going to be $9,000 a year. So he was fully funded his HSA.
So he was capped.
I couldn't get him to move. He never moved. I'm like, dude, move. And it was going to make me lose money. But he's like, no, I'm just going to keep what I like. But I mean, and that's the thing. People have to understand there's options. Talk to someone who's going to show you the options, even if it's going to make them lose money. But there's people that are sitting there on crap and they need to move and make a better option.
And you need to talk to an agent literally that is going to take care of you and tell you the truth. And you know, I think, you know, because you've diversified in insurance and you have property and casualty and you have other insurance vehicles, that's where my trust with you is. You don't get my health insurance.
Mm-hmm. I told you where to go.
Right. You told me where to go. But you get the other things.
I had it. And I said, Joe, don't do this.
Right.
Get off of this.
Right.
Go elsewhere.
Right. Which I appreciate. And I think the people that just sell health insurance for people, I would look for another agent.
I
really.
Agree with that too.
I mean, you should have other people to always follow the money, right? Always follow the reason behind it.
It's funny when you look underneath the hood sometimes.
Mm-hmm. Well, thank you for coming by. Thank you for all of the years of friendship with your family. I love watching the Von Trapps of Westminster.
It's the Von Darlingtons.
The Von Darlingtons.
As I like
very musical.
The Darlingtones.
Yeah, very good.
The Darlingtones. I like that one too.
So thank you for taking care of my family.
Yeah, appreciate it.
And trusting us that way, and so and my boy.
Yeah. Oh, I had a great time with Holden last night.
Yeah.
Or the night before last. It was fun.
Yeah. He told me. So I appreciate it.
Thank you. Good seeing you.
You too.
Thanks for tuning in to the Genesis Healthcare Podcast, empowering you to live optimally. Ready to take the next step? Visit thegenesisdifference.com today to learn more.